When they put you in the hospital, what happened?
They admitted me and they run some kind of brain test and all that on me.
MRI and CAT scans.
CAT scan,
Yeah.
At Oak Hill.
You for this? Did they give you any kind of meds or any kind of medication or anything?
Yeah, well, I'm very easily to get gout. So I was trying to explain to them that my feet was hurting from gout.
Mm-hmm.
And they gave me something to help the pain. And then I finally got the word colchicine out, which you can't get it in America no more.
Mm-hmm.
You have to get it from Canada. So they realized what it was my gout was acting up. So they gave me something for pain, but as far as they just let me just sleep and rest.
So basically, you didn't have any treatment at all for stroke from the doctors? And not one thing did they give you that actually treated stroke?
Nothing that I know of.
Nothing. Okay, well, this is kind of what I'm finding out, because they didn't. When I was in the hospital for the stroke, I never got one thing for a stroke except a baby aspirin. That was it. I had all these CAT scans, and did they do a lot of blood tests on you?
Mm-hmm.
And did anybody come and tell you and explain to you what was happening?
Not really.
So all they did is
just told my husband in the emergency room she's had a stroke.
And that's it. Mm-hmm. Nobody come and talk to you. Nobody. Same thing with me when I was in the hospital. I had to have the nurse call the doctor and tell him to come and talk to me because nobody was.
Well, I even asked to go home, and some guy came in and said, "You can't go home. You're sick." I said, "No, I'm not sick." Mm-hmm. He says, "It says here on these papers you're sick." I said, "Tear the papers up and I'll be better."
Did you have to see a speech therapist?
No, because I think because I slept for a couple of days, that everything relaxed and kind of helped itself. Mm-hmm. I have no chronic damage except in my right hand, and it's mainly in my finger.
Yeah. Mine is my coordination. My hand has plenty of strength, but my coordination to play the fiddle and play the guitar is just not there yet. Mm-hmm. The doctor told me that I would probably come back completely since it was very mild. But I actually had 3 TIAs. Did they consider yours a transient ischemic attack?
Yeah, TIA.
Yeah, TIA.
I had 2 of them.
You had 2 of them?
Yeah, I've had 2 since I've lived here in Florida. And, but as far as any therapy or anything, except just like you said, just a mild blood thinner. That's all I had.
Yeah.
I was
a baby aspirin.
I was taking that anyway because I've had 4 bypasses. Mm-hmm.
Oh, you had a heart attack?
Years ago. Year 2001.
Wow. Now, when you went in the hospital, you noticed your blood pressure was very high?
It was up, but not extremely.
Do you remember what it was? I know mine was very, very high when I went in. Okay, well, what did you do to rehab yourself?
Exercised at home, in the bed.
Exercise in bed, yeah.
Because if you exercise in the bed, you're using more muscles than if you lay right there on that concrete.
Is that right?
Yeah, because you have to balance yourself on that.
Do you do a lot of walking?
No, I can't walk because of my hips and
my
knees.
Okay. So do you use stretches?
Yeah, when I lay in the bed.
Stretching?
Yeah, stretch. And take deep breath because
and you didn't have any effect on the face? Well, you're very fortunate.
No, it's just
because my left side.
The problem I have found is my short-term memory. I can tell you something happened 30 years ago, but don't ask me what I had for lunch yesterday.
Okay. Short-term
memory. If I really think about it, I can tell you. But as far as, what really was damaged, my short-term memory.
What about vision? You had no issues with vision?
The first stroke I had damaged my eyes. And it blurred my vision real bad. And then when I had the second stroke and I went back to the eye doctor, and he kind of laughed and he said, I don't mean to laugh, but he said that second stroke helped your vision. It reversed the damage.
Amazing. God's been watching out for you, hasn't
he? And he is an eye surgeon. It's not, Dr. Melatonin.
Okay, now let's just say that somebody is watching us right now, or somebody will be watching us right now. What would you say to a person who hasn't had a stroke, but has a probability of one, to do, or to recommend?
I know you can tell somebody's had a stroke by their speech. They have to stick their tongue out.
Yeah, yeah.
I do know
Yeah.
the things
But
to
would
watch.
you recommend that they eat better,
Oh,
eat
definitely.
healthier,
Healthier, don't smoke,
don't smoke, eat healthy?
eat healthy, and get exercise. Main thing, get